morning. So I'm gonna perform a tracheostomy care. So when you do this, first is we check the patient's chart, obtain any relevant information, and then once inside is before that we make sure we sanitize or wash our hands, introduce ourselves to the patient by letting them know that good morning, my name is Anthony, a respiratory care student from the respiratory department. So I'm here to clean up your tracheostomy, and then it will help prevent any infections or being exposed to too much secretions. So once you're done is of course we also check the patient's ID band for confirmatory purposes. Make sure we also have to reassess the patient by listening to the breath sounds, if there are any abnormal lung sounds, and also looking at the vital signs such as the SpO2 and heart rate. And then moving on, make sure we have the supplies ready. Make sure everything is complete, such as if we have the tray kit, we have the hydrogen peroxide, and even the sterile water. So with the cotton applicator, it should have more than one. And then we also have at least another clean gauze, different clean tracheostomy tube kit, and then also we also have a clean velcro or a tracheostomy tie. With the tray kit, we have to pour adequate amount on the side with the sterile water, and then on the other side is the hydrogen peroxide. And then we also have to observe and check the tracheostomy itself by knowing if it is the appropriate size that we're bringing along with. And then with that is we have to wear appropriate PPE such as gloves, sterile gloves, or even a PPE such as a face shield or a mask if there are splashing fluids present. And then if removing the inner cannula itself, especially if it's a non-disposable one, we have to carefully hold it up, and then the other one is support it with your fingers and then twist it because it's been locked, and then carefully remove it. Make sure if it's an indisposable one, we have a permanent inner cannula to put it to the patient. If we have the patient to be using a disposable one, everything should be disposed to the proper waste disposal. And then before that is we always have to suction the patient. When suctioning it, make sure if this is the stomach, we should not push it too deeply, the suction catheter itself, because it might cause any trauma to the tracheostomy. And then we also have to inspect also other things such as the gauze pad. Of course, we have to replace it with a new one regardless if it's soiled or not. And also if we use the traditional way of the tracheostomy, if using a trach tie, we also have to replace it with a new one. And then with the non-disposable one, if this is the inner cannula, we always have a brush in place, because with that we're going to clean it up. If this is the non-disposable one, clean it up with a brush in the hydrogen peroxide, and then after you're done is we have to clean it when sterilized in a sterile water and allow it to air dry for a few minutes. And then with the gauze pad, make sure we carefully remove it like that, and then replace it with a new one, put it here in between. And then we also have the cotton applicator with the hydrogen peroxide. Clean it to the stoma itself. If we clean to the stoma, carefully in a circular motion, but not push it too deeply, just near the outside. And then make sure we dispose everything. And then with the other cotton applicator is we have to clean the exterior portion. If this is the stoma, we're gonna clean it here in between. If there's the plate itself, carefully insert it, not too deeply also, to prevent accidents of hitting the stoma itself and cause any bleed. And then with the tracheostomy tie, if removing it, make sure we carefully cut it with scissors, and then with our other finger remove supporting the neck plate itself. And then if we cut the tracheostomy tie, make sure we set aside the pilot balloon itself to prevent from accidents of cutting the balloon. But nowadays we usually do or use the new one such as the velcro. If we replace it with a new tracheostomy tie, we're going to insert it on this side and then kind of loop and insert in the other side. Then make sure we tie it both securely, and we can measure it if it's just too tight with our two fingers, or if it's just too being loosened too much for the patient. And then once everything is done, make sure everything is being disposed. If we those soiled items such as the PP and even the tray kit, and then make sure we always listen to the breath sounds.